Hi, I'm Dr. Paul Frank, and I'd like to welcome you to my channel. Today, we're going to talk about vitamin D's critical role for COVID-19. What I'm going to do is I'm going to put all the pieces together for you because there's a lot of information in the media, but they don't really pull everything together. So we're going to pull everything together for you. First, I'm going to start out with research suggesting vitamin D is essential for COVID-19. Then what I'm going to do is I'm going to talk about vitamin D and how it works for all stages of the disease. Then we're going to go over the 4 physiological effects of vitamin D, because a lot of people go over the immune reaction and the immune benefits of vitamin D, but there are actually 4 benefits of vitamin D. And if you understand all 4, then you'll understand why vitamin D is essential for many other disease processes in the body. And please like this video and subscribe to the channel so you can keep up with the latest videos that we produce. And again, I appreciate any contribution to the channel because it takes a lot of time and energy to put these videos together. So I super appreciate your contributions. Well, let's start out with vitamin D and the severity of COVID-19, because this is the first research that really came out on the subject. So first of all, if you look over here, see this green box, it's at 30.2 nanograms per milliliter. So that's the amount of vitamin D that was in the blood in these people that had mild symptoms. Okay, now as the vitamin D level goes down to 27.4, then you start getting more ordinary symptoms of pneumonia, you know, chest x-ray, and you're starting to get these symptoms of pneumonia. Now, if you drop to 21 or drop below 21, you're going to start getting more severe symptoms of COVID-19, according to the research. But when you get down to 17 or below 20, that's when you become critical and you may not survive the disease. So as your vitamin D levels go up, your survival and your symptomatology gets better. Okay, so I'm going to talk about later in the video exactly why this vitamin D modifies the immune system and gets this effect. So let's look at the survival. Now, vitamin D, again, less than 20 nanograms per milliliter, you've got a much higher rate of death, you know, from the infection. But if you bump up to above 30, your rate of survival goes up. And again, we're going to discuss why that is. Now, let's go to the critical ill. You know, if you're critical with COVID-19, what happens when you add vitamin D? Okay, so in Spain, 76 patients were hospitalized with COVID-19. Okay, and they were hospitalized because they were critical. They were confirmed with viral pneumonia on X-ray. And the viral pneumonia was SARS-CoV-2, so they tested positive. Okay, now all these patients that entered the hospital, they're critical, so they entered the hospital. 50 patients of the 76, 50 patients received 20,000 international units of calcifediol. So this was vitamin D, but it was the converted form of the vitamin upon emission. Now I point this out because the converted form enters the body a lot faster because it's not fat soluble, so it enters right away. And it's already converted, so the liver doesn't have to convert it. So in the critically ill, the liver doesn't have to convert it. So that was genius upon these researchers that put in this converted form. So then they gave 10,000 international units of the converted form at day 3, day 7, and weekly until discharge. No deaths and 1 admission on ICU. Now think about it. You don't have any deaths and one admission to ICU, that's pretty good chances of increasing your survival from going from critical to getting out of the hospital, and only 2 ICU admissions. Now let's compare that to the 26 that didn't get vitamin D. No vitamin D. You had 2 deaths, okay, so increase in death, and half of them kept getting worse and ended up going to the ICU. Okay, now that's pretty incredible. So if you're an ER doc out there, wouldn't it make sense to give everybody that comes in with COVID-19 vitamin D in the converted form? Don't give them vitamin D3, give them the calcidiol. Okay, because you're not going to hurt them, and you may just save their life. So that's pretty crazy. Now I'm going to show you in a minute the reason why vitamin D kicks in all these systems of the body that's for survival. Okay, now let's look at giving vitamin D in the elderly in COVID-19. Vitamin D supplementation during or just before COVID-19 was associated in the frail elderly with less severe COVID-19 and better survival rate. Well, think about it. I think the average age of death from COVID-19 is about 78. I may be mistaken on that, but I think it's about 78. So those are the people that are more at risk. Now, those people received a single dose of 80,000 international units every 2 to 3 months. That's not the way to give it. Every day is the best way to give it. So giving it every 2 to 3 months, they still have better rates. I'd say that's pretty incredible. I wouldn't think they'd get that good a result, but they did. So think if you did it right, then they'd even get better results. Okay, let's look vitamin D and the prevention of SARS-CoV-2. Okay, so down here, remember 20 nanograms per milliliter? That's the magic number. Below that level, you had a 54% higher positive rate. Now watch this. As you go from lower to higher, you decrease that positive rate. So as you go up to 55 nanograms per milliliter down here, SARS-CoV-2 positivity continued to decline until the levels reach 55 nanograms per milliliter. So this is highly suggestive that you want to keep your blood levels at least 55 nanograms per milliliter. I'm going to show that you might want them a little higher, but that's still a good survival rate. But that's less positive tests, okay? So that's incredible on a prevention strategy, okay? Now let's look at vitamin D status in hospitalized patients. Vitamin D deficiency was found in 82% of COVID patients. I think vitamin D deficiency was found in 47% of non-COVID patients. So definitely increases with the COVID patients. Now, vitamin D deficiency in COVID patients had a longer length of hospital stay. So you get over the virus faster, especially if it's greater than 20. Remember, 20 is what you do not want to go below 20. That's like playing Russian roulette with COVID-19. Okay, vitamin D supplementation increases viral clearance in asymptomatic patients. Now, what does that mean? That means that people that don't even know they have the virus, they're reproducing the virus in their cells, they're shedding it in their nose, and it's going out into the world. And if you give those people vitamin D, they will increase viral clearance, meaning they'll get rid of the virus a lot faster. So daily dose 60,000 international units of vitamin D3. Taking vitamin D, 10 of the 16 or 62% became SARS-CoV negative. In the people not taking vitamin D, 5 of the 24, 20% became negative. So an increase in getting rid of the virus, higher percentage, getting rid of the virus sooner, even if you don't know you have it. And that's definitely beneficial. That means you'll spread it less to other people. That's a good thing. Okay. Now let's look at higher vitamin D levels and lung involvement. So higher levels of vitamin D, less lung involvement. So less lung infection, less lung destruction. So you may survive with getting a lung infection, or I'm sorry, COVID-19. But if you have higher vitamin D levels, you'll have less destruction and less complications after you get rid of the disease. Vitamin D deficiency, increased risk of mortality. So just, if you're going below 25 nanograms per milliliter, you're going to increase your risk of mortality, no doubt. So what we're showing here is vitamin D at every level helps you. So fighting the virus before you even know you have it, clearing the virus before you know you have it. When you get into dysfunction that leads to the cytokine storm, if you give it with the severe cases, you might get less organ damage. So vitamin D helps in all levels. Now let's make this crystal clear. Okay, so the immune system composed of two branches of the immune system. One is your innate response. That's what's going to overshoot in the cytokine storm. These interleukin 6 overshoot and gives you that cytokine storm. Now, when you get COVID-2, you also get less antibody production. So it suppresses this system and it ramps up this system in a bad way. So COVID-2 really causes a lot of havoc with your immune system. But let's go down here and let's look at a lung cell. When you are introduced SARS-CoV-2 to a lung cell, if you have adequate vitamin D, remember it shows less positive testing with higher vitamin D levels up to 55 nanograms per deciliter. So you want your vitamin D levels up high. It'll protect you from getting it or shedding the virus, testing positive. Okay, so vitamin D protects you against getting a positive test. Now, what if the virus gets into the cell, starts reproducing, and you get a positive test? So they stick that thing in your nose, pull it out, and you've got virus on that that test. So that says that you're reproducing, you're using your own machinery to reproduce that virus, and it's going out into the air. And what if you give vitamin D at that point? Well, that shows that you clear the virus, you get rid of the infection a lot faster with vitamin D levels up. Okay, that's a good thing. Now, let's say that you're an older person, your immune system's not functioning very well anyway, and then you get COVID-2 on top of that, and then you go into the cytokine storm and blood clotting, all this sort of inflammation, and you go to the hospital because you're severe, like those patients in that study from Spain. And you have a bad case of symptomatology related to SARS-CoV-2. Now they give vitamin D in that case. Now they give the converted form, not the vitamin D3, but the converted form. And that kicks in your machinery a lot better to fight the virus a lot better. And now you are able to build antibodies a lot faster. You decrease the cytokine storm and you have a higher survival rate because you're kicking in your antibody production and you really you clear the infection with less symptomatology and less death, hopefully. So vitamin D at every level is absolutely critical, whether you're preventing it, whether you're a viral infection, you're going in the cytokine storm, any level. Now think about it. They might come out with drugs that antiviral or anti-inflammatory that may help with your survival. But wouldn't you want to kick in your own machinery to increase your survival rates? Yes, absolutely. I cannot think of anybody on the planet that you wouldn't want to give vitamin D and bring their levels up to 55 to 60 nanograms per deciliter or per milliliter. I can't think of anybody that you wouldn't want it. And especially in the hospital, you give them the converted form. So anybody, if you're a clinician out there and you're working in the emergency room, please give your patients that come in the door vitamin D to save their life in the converted form, the calcidiol. Okay, let's look at this from a bigger perspective. Sunlight, less sunlight increases mortality. Well, this is easy to understand why when you go from the equator, which is right here, all the way up to the north, from the equator, as you go up, the cases rise because country by country, you have less vitamin D. Plus, you have maybe an older population in Italy. You add all those things together, boom, you have a powder keg for, the SARS-CoV-2 having a higher death rate. Here's the United States right here, per population. Okay, so that's per population there. Now look at skin color. People of color are dying at a highly disproportionate rate, according to research. And I put all the research down here for you to review if you would like. From COVID-19, in New York City, per 100,000, 92 darker skinned people, 45 lighter skinned people. The only difference is what? The skin is dark, so it filters out the UVB, and you don't get enough sunlight to make vitamin D. Okay, so as your skin gets darker, you're going to have less vitamin D on board, and it's going to decrease your survival. So let's review this thus far. High risk, obesity, obviously. And obese people have lower vitamin D levels in general. And I may do a whole presentation on obesity and vitamin D. But basically, if you have comorbidities like obesity, heart disease, you will want to check your vitamin D and get them up to at least 60, Okay, now what about your elderly, which is the middle? They're not getting out in the sun. Some of them are in nursing homes. So you're not going to get vitamin D. And the older you are, the less effective your immune system is. So you need vitamin D for survival. Okay, so give the people in nursing home vitamin D. And people of skin color, the darker your skin, get vitamin D on board because it increases your risk. And there's the research that you can review on that. Vitamin D insufficiency may account for almost 9 of 10 COVID-19 deaths. Well, I think that's a little unrealistic. That's just my opinion. I mean, I know it's a review of the research and it's somebody else's opinion, but I'm going to say my opinion is more like 7 of 10. If you get your lab values up, it's going to be more like 7 of 10, not 9 of 10. So I disagree with this conclusion. But you can read the article yourself and see what conclusion you come to. So observational studies suggest that the majority of deaths due to SARS-CoV-2 infections are statistically attributable to vitamin D insufficiency. Rational vitamin D supplementation to limit the toll of the pandemic. Yes, I think every ER doctor should be giving vitamin D to anybody he suspects of COVID-19 coming in to save their life. or at least give them a better chance. Give them a better chance to save their life. Because what vitamin D does, it doesn't work like all the other vitamins and minerals necessarily. It has a pro-survival effect by kicking in the machinery. So it's like turning on the light switches in your body, okay, which is different than other vitamins. It's a hormone at some point, and it turns on the machinery that's pro-survival machinery. And I'm going to go into exactly how it does that just on a basic level. So don't worry, I'm not going to lose anybody. I'm going to do it just at a basic level. So how does vitamin D increase survival? Well, I'm glad you asked. Okay, when I started looking at vitamin D, I was really skeptical because how can vitamin D influence so many disease processes like cardiovascular disease, hypertension, cancer, autoimmune diseases, rheumatoid arthritis, osteoarthritis, allergic, allergy and asthma, infectious diseases, mental disorders, gingivitis, metabolic syndrome, and diabetes? How could one little vitamin affect so many different disease processes? Well, once I understood the mechanism by which it affects the body, then I understood, easily how it would affect all of these diseases. So that's why I'm going to share this with you now. So vitamin D has 4 major functions on the body. And all I've heard out there is just promotion of 1, and we're going to cover all 4. So it's like having 4 light switches, and those light switches hooked up to the lights on your house. So if you hook up all these lights and you spend all the time getting the machinery in place, which we have the machinery in place in our body to fight diseases, vitamin D flips the switch. So without flipping the switch, can you turn all those lights on? No, you can't. So vitamin D, it doesn't change the mechanism that's in your body other than it turns it on, or in some cases turns it off. And that's why vitamin D increases your survival rate. So first I'm going to start with the immune system, because that's what's been promoted out there on YouTube and everywhere else, is the immune system. I'm going to start there. So first of all, what I want to do is I want to show that without vitamin D, you can ramp up your immune system and you can fight all these different viruses, okay? And you can do that effectively, especially the younger you are. So the younger you are, the more effective you are ramping up your immune system and fighting disease. Now, when you get older, and say you're 60 plus years old, you might have problems ramping up this immune system, and you might actually overshoot and cause immune pathology related to the cytokine storm. But you can fight effectively viruses without vitamin D. Now, let's look at what happens when you add vitamin D. So when you add vitamin D, you kick in these systems a lot better that fight viruses. That's why you clear viruses a lot faster. Like we saw with the SARS-CoV-2 in those asymptomatic patients, when you added vitamin D, you kicked that virus a lot faster, a lot better. And that matches all the research of kicking other viruses a lot faster and having less symptomatology. So it all correlates. Now, in an older adult, you may have this inflammation reaction overshoot and actually cause pathology called immunopathology. So this I want you to focus on IL-6, because vitamin D decreases IL-6, which is part of this cascade okay, that leads to the cytokine storm. So if you can decrease the cytokine storm, especially in an older patient, you're going to maybe save their life. And that's why we saw the life-saving properties suggestive of the earlier research. Okay, so specifically, what am I talking about? Vitamin D in COVID-19. So here's the virus. It comes in, it turns on the machinery or the DNA that encodes for this interleukin 6 that's pro-inflammatory and leads to the cytokine storm. Vitamin D comes in there and says, hey, we need to shut it off at the switch. We need to shut that off, stop production of interleukin 6, stop that cytokine storm, and let's get those patients out of the ER a lot faster and with less organ damage. Okay, so that's why it's critical to have vitamin D on board for survival. So here's the benefit is the immune system, it decreases the cytokine storm in the lungs. Now watch this. Not only does vitamin D go to the lungs, but it goes to other organs. Watch this. Decreases inflammation in the arterioles, leading to arterial sclerosis. So it ramps down this interleukin 6 in the arteries that leads to arterial sclerosis and artery damage, just like it does in the lung. Wow, that's amazing. That's why you can have other things affected besides COVID-19 by adequate vitamin D levels. Now watch this, decreased inflammation in the GI tract. So if you have GI complications due to overactive immune system, so that's why I'm going to produce later videos on cardiovascular disease and GI tract diseases related to vitamin D because of its effect on other organs based on this fundamental mechanism of physiology. And then there's other things like autoimmune disorders and cancer. So maybe in the future, I'll do something on those. But I'm just hitting the overview, just so you can understand from a big picture. Now let's cover the next thing. Now this is really pretty exciting, the epithelial tissue. This really excites me. So I hope it excites you as much as it does me. Epithelial tissue. So what does it do for epithelial tissue? Well, first of all, let's understand, where is epithelial tissue? Epithelial tissue covers all of your major organs like your skin, your lungs, your digestive tract, your kidneys, your bladder. Everywhere you have epithelial tissue, or everywhere you have an organ, usually you have a functional tissue called epithelium. Now that epithelium is a different type because if it's in the lung, it has to be flat because it has to get oxygen in and out. So it's a different type of epithelium. In the kidneys, it's going to be a different shape because it needs to be different, has a different function to balance electrolytes. Maybe in the digestive tract, it's going to be in columns so you can get your nutrients in the body from your intestines, get the nutrients in. So it's a different shape. And maybe a different shape in the skin and the esophagus so that it's layered. It's these flat cells that are layered, say, so that you have, when you brush against your skin, you have a lot of layers and they're hardened so that they don't slough off as easy. But it's the same tissue. It's the exact same tissue wherever it's found. It just has a different function, so it looks different. That's all. But every epithelial cell has vitamin D receptors. That means it can pull in vitamin D and it can activate vitamin D. See, back in my day when I learned physiology, all we thought was it activated vitamin D in the kidneys. But now researchers know that you activate it in every epithelial tissue in the whole body. That's why it's so beneficial. Okay, so it activates vitamin D. So what happens when it activates vitamin D? it has a protective effect that I'm going to go into a little detail later on how it protects you. And it protects all epithelial tissue, not just what's in the lungs. It decreases inflammatory processes that precede arteriosclerosis. Now watch this. The same tissue that's in the lung is that flat cell. That same flat cell, to get oxygen back and forth, it's a flat cell in the arteries, so you can get oxygen back and forth. So it lines all your cardiovascular system, the flat cells that are epithelial. And because it decreases inflammation, because it suppresses IL-6, it stops arterial sclerosis. I think that's amazing. Okay, so wherever you have an epithelial tissue and you add vitamin D, it's going to have a protective effect. So what's that protective effect? Well, now I'm going to go into a little bit detail, but I want to do that just for the clinicians watching this video. If you get a little lost, don't worry. I'm only going to do this in this video, but I'm going to try to present it on a very basic level. So this is an epithelial cell, and that could be in the liver. It could be in, or it could be in the lung. It could be in the kidney. It could be in the digestive system. So how does vitamin D keep this epithelial tissue healthy? Okay, number one, it suppresses the IL-6, the interleukins. It inhibits the overproduction of the inflammatory part of the immune system, which is absolutely critical. So in the GI tract, that might help with irritable bowel disease. In the lung, it helps with asthma. In the skin, it helps with infection. Okay. Now, better gap junctions. Now, this is the most important thing I'm going to talk about right here is gap junction. Now, what is a gap junction? Well, if I have this cell, it's got to stick to the next cell. Or, if my skin, if the cells don't stick together and I rub it, they're all going to fall apart real easily. So the body has this glue that sticks one cell to the next. So in the lung, I've got to stick one lung cell to the next lung cell, and it does through so this glue called a gap junction. Vitamin D makes sure the gap junction is really tight. So maybe in the lung, if the gap junction falls apart, you're going to get edema because the proteins are going to escape into the lung tissue and pull water or fluid with it, and that's going to cause edema. Maybe in the intestines, you're going to get leaky gut syndrome. Okay, so in the skin, you get skin falling apart. So you want to have healthy gap junctions. Now the next thing is reduced calcium influx, which has to do with vascular tone. Because if I can't control my calcium going in and out of the cell, I'm going to have a big problem with having hardening the arteries, calcification of the arteries, and muscle contractions, all sorts of things. So counteracts the dangerous effects of advanced glycation. Okay, well, what does this mean on let me simplify this. In your, say you're diabetic and you have high sugar levels. Sugar is toxic to these endothelial cells, or the cells lining your blood vessels. So vitamin D comes in and turns on machinery that produces compounds that counteract high sugar level damaging effects on endothelial cells. So that's a benefit. Now, the last two I'm going to just cover briefly. Increased nitric oxide production. Nitric oxide production helps with decreasing blood pressure by relaxing muscle in the arteries, okay? And it decreases reactive oxygen species, or decreases inflammation, because in our the cells, and we're going to talk about them later, but in the part of our cell that produces all of our energy, they produce inflammation. So it decreases the inflammation produced in the cell by producing energy. So all of these beneficial effects are produced in all epithelial cells. So all epithelial cells all over the body, whether it's in the skin, in the kidneys, anywhere in the body, it's helping. Okay. Well, here we go. So let's take two examples just so I can drive this point home. Deficiency of vitamin D in the lungs. What does that do to the lungs? Well, if you have one lung cell next to another lung cell and you've got it stuck together with gap junctions so that nothing leaks through, okay, that's a healthy lung tissue. Now, with a vitamin D deficiency, you have accelerated decline of lung function. Do you see if you can't turn on the machinery that creates normal physiology or normal, work? If you don't put gas in the car, it's not going to run. Okay, so you can't build healthy tissues. So you're going to have decreased lung function. So when the lung function decreases, do you think you're going to get more pathology or more disease? Absolutely. So chronic vitamin D deficiency, chronic respiratory diseases, which include cystic fibrosis, interstitial lung disease, and COPD, associated with increased risk of respiratory infections like influenza A. Yes, if you can't build healthy tissue and have healthy gap junctions, you cannot fight bacterial infections, not to mention the immune system, so you have to have healthy cells and a healthy immune system. And absence of vitamin D receptor in mice lungs create early onset of emphysema, COPD, because of chronic inflammation, immune dysregulation, and lung destruction. Now think about it. If you take out, so you can breed mice to where they don't have vitamin D receptors. So whatever vitamin D is there will not influence the genes and turn on the machinery that save your life. So if you don't have the vitamin D receptors, you're going to lead to more emphysema, COPD, inflammation, and lung destruction because you can't turn on the machinery. Okay. So what if you don't have enough vitamin D? You can't do the same thing. So either way, you can't do the same thing. Now, one point here, as we age, we get less vitamin D receptors. So do you think you need more vitamin D as you age to stimulate these vitamin D? Yes. So now let's do a quiz here. Let's assume that you're a pulmonologist. Well, what's a pulmonologist? They are a doctor that specializes in lung function. So you're a lung function specialist. Now, if any disease of the lung, wouldn't the first thing you do as a pulmonologist is give vitamin D to get the vitamin D up in the level 55 or higher, 55 to 80, to kick in the machinery to build strong, healthy lungs? That would make sense. A first thing you do before you maybe give a steroid to decrease inflammation in the lung, or before you give an antibiotic to kill a virus or a bacteria infection in the lung, wouldn't you want to bring the lung up to the healthiest point you can before you do that? Now, you may be critical, so you give vitamin D as you give the drug, say. So that's the test there. So my point is, you want to give the preventative or the primary benefit before you give the secondary benefit of the drug, because the drugs have these dangerous side effects that you don't want to have to give if you don't have to, if you can get the body functioning better. Okay, now let's do the same thing with the skin. So let's assume that you're now a dermatologist, which deals with the skin, So vitamin D is made in the skin here. Now, if it's deficient, then you don't have proper wound healing. You don't have a proper defense against bacteria. You can't mount an immune response, okay, and all this. You can't turn on that machinery to have healthy tissues, okay? So as a result of that, you leave that long enough and you're going to get diseases related to a vitamin D deficiency, like skin cancer, psoriasis, acne, infections, okay? So you're a dermatologist and you have one of these diseases. Wouldn't it make sense to give vitamin D because that's epithelial tissue? Wouldn't it make sense to give vitamin D and build good gap junctions and turn on all the machinery that allows the body to build better quality cells first, and then give the topical cortisones, the topical antibiotics, do all that, or give it at the same time? Wouldn't that make sense to turn on the machinery along with? And so that would be my suggestion. Okay. Now, so we've talked about the immune regulation. Now we've talked about epithelial tissue for GI repair. Actually giving vitamin D, and I don't go into this, but it can actually repair tissue. Okay. Now, you might be a skeptic out there and you might say, well, wait a minute. I took vitamin D, I took 2,000 to 4,000 international units of vitamin D, and it didn't cure my, disease related to my skin. Well, later I'm going to show you that 2,000 to 4,000 international units is not enough to have an effect on the DNA transcription and all that. So you may have been at a too low of dose. But also, I want to point out that vitamin D is needed to build a strong child from in utero. So you're building those tissues as the mother needs vitamin D as you're building a strong, fetus and baby. So if you don't build a strong child and you go a whole 80, 60 years of being vitamin D deficient, and you create all this irreversible damage by doing that, and then you put in vitamin D, you may not reverse all of this. So there's some limitations to what you can do with vitamin D. So my point is, an ounce of prevention beats a pound of cure. Okay, so that covers that topic. But epithelial tissue is number 2. You want to have adequate vitamin D levels to build healthy tissue. Now, muscle tissue. You can build better heart function, skeletal muscle function, performance, increase it, and better smooth muscle function. So all of your muscle in your body, by giving vitamin D and keeping them at adequate levels throughout a lifetime, you will have better function of your muscle. And I'm going to go into greater detail on this when I do another video in that section. But I just want to cover the basics so you get the basic idea, just at a basic level. So here is your heart cell. Here's the vitamin D receptor. It pulls vitamin D, and it has 2 benefits for the heart muscle. It increases the strength of contraction, and again, I'll go over this later in a different video, but increases the strength of contraction, and it stops the muscle getting too fat, and I'll show you how a fat heart muscle pumps less blood, but also with a vitamin D deficiency, you produce more fibrosis. So you go from healthy tissue to fibrotic tissue, like cystic fibrosis, say, from a vitamin D deficiency. So you want to produce healthy muscle cells throughout a lifetime, okay? Now, so giving vitamin D to skeletal muscle, just briefly, look, improved knee strength, improved hand grip strength, okay? So you have stronger grip strength because that's related to, research shows that's related to longevity, grip strength is, okay? And improved 6-minute walk test. So you can improve the muscular function. Now, do you think that's going to help with falls and your walking? Yes. But now, if you're in utero, do you think vitamin D is going to build better tissues in utero if you have it? Absolutely. Now, if you're 60 years old, do you think it's going to improve the muscle function? Probably. There's a good chance you can if you give the right dose, you know. Now, if you're 80 years old and you can't walk anymore, do you think it's going to help? Probably not. So just be realistic in giving vitamin D and what you're going to expect. Okay. Now, I have saved the last one. Sorry, I flashed on screen. But I have saved the last one, which is the most important, for last. Because if you don't have the last one, then you won't have the function of any of these over here. So look, mitochondrial function. So what is the mitochondria? Well, all you need, that's a big fancy word to say it's the part of the cell that produces 90% of your energy. So if you can't produce energy, you can't mount a good immune system reaction. You can't build healthy tissue in the body. You can't have a strong muscle contraction. So all of these are dependent on mitochondrial function. And so that's your most important organ in your body. And probably most of you have never heard of it, but I'm going to cover it because vitamin D is critical for mitochondrial function. I'm going to show you why it's critical for COVID-19 as well. So it increases brain function, increases muscle function, less depression, increases stamina, decrease oxidation, and increase healing, okay, by increasing your mitochondrial function, okay? So that's why vitamin D is good for the brain and all sorts of things. So let's briefly look at what does the mitochondria do? Now I'm just going to briefly hit it, but let's say I have sugar or fat. Now let's say I burn fat, okay? So the fat in it has these carbon chains all lined up. And sugar has the same carbon chains all lined up, just less of, but basically they're the same, but you know, different, but the same as far as energy goes, because the carbon chains have these high energy bonds between them. Okay, now if I burn sugar, you know, burn corn, or I burn fat, you release that energy very violently and you release a lot of heat. But what if I take that same sugar and fat and I run it through my mitochondria in my body? Then I release a little bit of heat, but I do it in a chemical way so that I build up another product called ATP while releasing the heat, okay? Now, I build up that ATP and I can use that in the body as my universal energy. So it's like my dollar bills in my body, you know, for buying things. And so less aging by functional mitochondria because I can use that ATP to drive cognition, immune function, cardio fitness. Anything in the body uses ATP as energy currency. Okay, so do I want a mitochondria to function healthy or not? Yes, I want healthy mitochondria. So vitamin D produces healthy mitochondria to produce healthy aging. And it does it in one of four ways. It removes dysfunctional mitochondria, reduces mitochondrial dysfunction, so they produce more ATP, reduces oxidative stress, because basically vitamin D kicks in our own machinery to produce superoxide dismutase, which in relationship decreases inflammation. And it decreases, okay, all it does is it increases, it decreases the effects of aging because it increases your ability to produce energy. Okay, now why is that critical for COVID-19, you ask? Very good question. Okay, so SARS-CoV-2 appears to hijack host mitochondria and suppress host immunity. So here comes your virus into the cell, gets into the cell, hijacks your mitochondria. It creates dysfunctional mitochondria. Well, you might say, what does that do? Well, dysfunctional mitochondria, you can't mount an effective immune response. It paralyzes the innate and the adaptive immune response. Okay. Plus, it creates all this excess inflammation because of destroying your mitochondria. So that leads to the pathogenesis of COVID-19. Okay. Now, how does that also lead to blood clotting? Because you know how blood clotting is a part of COVID-19. Well, I'm going to show you exactly how. So the virus comes in, it hijacks your mitochondria, it makes them dysfunctional. Now, if those mitochondria are dysfunctional in something called the platelets, and the platelets are just in the blood. That's all you have to know is platelets are in the blood. And when you get dysfunctional mitochondria or energy producers in the platelets, they start to become dysfunctional. Well, what happens when they become dysfunctional? They start to clot or stick together and cause clotting. Well, if you have clotting in the blood vessels, you have big problems because you can't get blood to all your organs. So then you succumb to the infection. So see how the virus doesn't kill you. It's your reaction to what the virus does to you if you don't have enough vitamin D to protect your mitochondria and keep them functional. Okay, that's when vitamin D is going to get you. Now, there's a point of no return. If you get bad enough and you give vitamin D, even if you give the converted form of vitamin D, you get the patient bad enough and they're not going to reverse out of that. Obviously, prevention is the best, cure here. So again, if you're in, if you work in the OR, I'm not the OR. If you work in the emergency department or the ER, if you work there and you're not giving vitamin D as the patient comes in the emergency room, you're not giving that patient a good chance of survival. So it's absolutely critical that you give vitamin D. Now, let's, before we wrap this up, frequent complications of vitamin D. Let's see if we understand what we just went over. Now, vitamin D turns on the pathways that are the survival machinery that decrease pathology in COVID-19. So you have cardiomyopathy in COVID-19. Here's the research if you want to look at it. Cardiomyopathy, and so a weak heart muscle. So over here we have helps mitochondria, helps heart muscle, so that's going to help. Thromboembolism, so basically blood clotting. Okay, well, we showed how it helps the mitochondria function better, which leads to better platelet function, which leads to less blood clotting. Pulmonary embolism, so blood clotting in the lungs, blood clotting in other vascular places here, disseminated intravascular coagulate. That's all that means. Arterial clot formation. That's just more clotting in the arteries. Septic shock, meaning you clear the virus a lot faster with a lot more, a lot quicker. So then you won't have the chance to go into sepsis or shock. Okay. Again, multi-organ failure that's a result of all this from not enough of this, of turning on your own machinery. Now, that's not to say that you don't want zinc. Zinc's going to help you. You know, that's why they put President Trump on both vitamin D and zinc, because you may turn on the machinery, but you still need zinc to work processes that are similar to vitamin D. So yes, you need your other vitamins and minerals, but you need vitamin D as a core. How much vitamin D is protective? Well, I put a part one, which is you can go to YouTube and look it up. It looks like this, but at 39 minutes into the video, I go into a better detail of the blood lab values, but I just want to give you enough because I know you're all going to want to take it. So how much do you have to take? Well, I'm going to go into that. Now, to turn on your genes, how much vitamin D do you need? Because when we measure lab values, you know, 20s, 30s, 40s, 50s, that doesn't mean that your genes are being expressed. That just means that you're testing the inactive. The inactive that's in your blood is what you're testing. So let's look at the research. Let's start with 600 international units. Now that's what the RDA tells you to take is 600 international units, 600 to 800, okay? Now that's gonna take you from 17. Now remember 17 is critical from some of that research we looked at. 17 is critical. That puts you up, you're still critical. Now you've turned on more genes, but you're still critical. So I wouldn't recommend, if you want to survive COVID-19, I wouldn't recommend taking the RDA. I would recommend, well, what if you take 4,000? That's a little higher. Now I've taken 2,000 to 4,000. And so what does that get you? So you go from 22 on average to 40. Now 40 is the minimum that you should ever be, is 40. Now, you turn on 320 genes. Now, is 40 better than 24? Well, survivability, yes, it is better. Now, remember I showed at 55, you need to get to 55 to have the best chance at not getting, you know, the virus, you know, from that one research that we looked at. Well, that was even higher than 40. So it's suggested that even 40 is not going to be enough, you know, but it turns on more genes than 162. Now watch this. Let's look at a sun dose. From the sun, you get 10 to 20,000. So let's look at giving a sun dose. You go from 17 to 78. That's more in the range of saving you, is 78. Because look, it allows you to express 1,289 genes. Now, let me ask you, if you're fighting COVID-19, do you want to fight it with this level, or with this level, especially if you go to the hospital? Well, if you go to the hospital, you want to be able to turn on all your, you want to turn this gene off, actually, and you want to turn these genes on for survival, okay? But you can't do that at a low dose. And the reason I'm showing you this is I took 2,000. That's the most I'd ever taken before I started looking at the research and going off what the research suggested. Well, I went off the research, I took 10,000, and I noticed, wow, I normally have this wheeze, you know, on exhale, or when I breathe out, I'd have this wheeze. And when I started taking 10,000, that wheeze went away, and it felt like I'm breathing through a pipe now. Well, it's because I wasn't kicking on my genes because I was taking too low of a dose. So I'm going to do a whole presentation on vitamin D levels and really go into it, you know, in depth. But this is enough to get you going. You need to take, let's look at the research. You need 600 to 800 from the research down here. 600 to 800 is insufficient. So the RDA is insufficient. Long-term daily intakes of up to and including 10,000 vitamin D maximizes physiological benefit, are safe and effective, okay? Now, you may need, if you have MS or cancer, your doctor may put you on a lot higher dose, but you're safe at 10,000. I don't think there's ever been any cases 10,000 up to 20. I don't think there's any case of 20,000. I think you have to hit 30,000 before you ever get, even the chance of that. Vitamin D deficiency is so rare out there. So you almost don't have to worry about it. Now I'm going to cover that in another presentation, but basically, take 5 to 10,000 and you're going to be covered. So again, thank you for supporting my channel. Super appreciate you being here. Please like and subscribe to this channel, because then you're going to get updated videos that I do on other topics, and not with vitamin D necessarily, a lot of other topics related to nutrition, health, and medicine. Please share this video with anyone you love or care about. Well, heck, share it with people you don't like, because they deserve a fighting chance at this COVID thing, so share it with anybody. And I definitely appreciate your contributions to the channel. So I'm going to leave a link in the description that you can contribute, because these take a lot of time and effort on my part to put this information together and make it easily understandable and put it out there on YouTube for the general public. So I do appreciate any contribution you can, throw in the direction of the channel. So have a happy, healthy, safe navigation through life, and I'll see you in the next presentation. Thank you very much.